Homes in Rhode Island flagged for infection control violations before the pandemic.
NBC 10's Tamara Sakarzik made the discovery while combing through federal citations. She takes a closer look at whether those violations could have contributed to the widespread outbreaks.
About 80% of coronavirus-related deaths in Rhode Island have happened in congregate care settings like nursing homes. I discovered 11 of the nursing homes with coronavirus cases have been cited for infection control deficiencies over the past 2 years.
The number one deficiency in nursing homes before the pandemic were infection control issues.
Numerous staff members failing to wash their hands, healthcare workers entering contagious patients' rooms without the proper PPE, and residents forced to wait 3 weeks to take a shower. Federal records analyzed by NBC 10 exposed several nursing homes in Rhode Island were cited for infection control deficiencies well before the coronavirus crisis.
It looks like close to 30% of the nursing homes in Rhode Island had been cited for some form of deficiency with respect to infection prevention and control.
Attorney Anthony Leone told me those deficiencies can range from the seemingly minor, like not practicing proper hand hygiene, to the more serious, failing to implement preventative measures during an infectious disease outbreak. 23 of Rhode Island's 81 nursing homes have been cited for such deficiencies over the past 2 years. Many of those same facilities have also had coronavirus outbreaks.
No one wants to have any deficiencies whatsoever, but as I say, they're automatically addressed immediately.
Rhode Island Healthcare Association President Scott Frazier told me he doesn't believe there's any connection between pre-pandemic violations and the current crisis, pointing to a recent report.
The most recent report that the Government Accountability Office came out with just last month showed that Rhode Island was best in the nation in infection control with a rate of only 3.8%.
That report cited numbers from 2013 to 2017, but we looked at numbers from 2018 to 2020 and found over 20 infection control deficiencies at nursing homes. So doesn't that suggest an increase?
What I can tell you is anytime there's a deficiency in any nursing home, it has to be addressed and addressed quickly, or else they're not able to continue operations.
That report showed 3 nursing homes in Rhode Island were cited for infection control deficiencies in 2017. We found that number jumped to 14 in 2018 and 13 in 2019.
Those numbers don't show the full picture.
We spoke to a nurse from one Rhode Island facility that has had nearly 50 COVID-19 cases. She didn't want to be identified, but says nursing home employees take infection control extremely seriously.
We are held to a very high standard of infection control on an ongoing basis. We are annually inspected and routinely inspected, and we report all outbreaks of infections to the Department of Health. So we are well prepared to deal with the typical infections.
But she says this virus was anything but typical, blaming a shortage of PPE and lack of testing for the outbreak, issues that people on all sides of the debate seem to agree with.
Challenges with infection control, not enough protective equipment available. This really is a perfect storm of what can happen.
Tamara Sakarzik, NBC 10 News.